Now back to our coronavirus coverage. Hundreds of people in Kern County have been inoculated with one of the two available COVID-19 vaccines, but thousands more have not because the rollout has been slower than expected. 17's Robert Price investigates the reason for the holdup.
Pharmaceutical companies have developed COVID-19 vaccines with incredible speed, and the distribution networks that have come along to get those vaccines out to various parts of the country have been nothing short of miraculous. But putting vaccines into people's arms, that's been the hard part.
Take Linda Wright, who lives in Rexland Acres, where she cares for 3 grandchildren. 2 of them, she says, are at a heightened risk of complications should they catch the virus. One has asthma, one has Down syndrome. Wright herself is 70, a risk factor unto itself. To protect them all, she says, she needs to be inoculated against the coronavirus. She has tried multiple times to make an appointment for herself from 4 local providers, including Priority Urgent Care and Omni Family Health. But as of Tuesday morning, Wright was still waiting for the promised callback.
I'm 70 years old, and I've been trying for days to get the vaccine.
She did get through to a live person at one clinic.
And I was 64 in line, and they said, would you give us your number and we'll return your call. And so I did, and that was 5 days ago.
The problem? The California Department of Public Health has distributed vaccines to Kern County Public Health, but also directly to local clinics and pharmacies. How many? Nobody seems to know. The state manages that data, and it took the numbers off the state public health website. Chaotic is how public health spokeswoman Michelle Corson put it. Dr. Grace Tidwell, Associate Medical Director of Omni Family Health, says the 7 days since the vaccine's rollout have been a scramble for everyone. And California will eventually need 80 million doses of the vaccine.
It's a huge number, and we're only getting about 500,000 per month, we hope. Yeah. That's what we're being told. So, I mean, just do the math.
Priority Urgent Care held a vaccine clinic at its Mount Vernon location where a steady stream of people with appointments were inoculated. Yolanda Nunez, waiting her turn with her husband Victor, said they were satisfied the vaccine would be safe and effective.
I'm getting the vaccine because I have underlying issues, and of course I'm 65.
Do you have concerns about the safety of it or anything like that?
No, I think, let's give it a chance and see what happens.
The clinic expected to give out free of charge about 100 doses of the vaccine during the one-day-only event Tuesday. Jessica Pena, General Manager of Priority Urgent Care, told me off camera they're proceeding cautiously until they know what to expect in the way of future deliveries of the vaccine.
Local hospitals and clinics say they're doing their very best to get vaccinations into people's arms, but until vaccinations become more available, they're going to have to ask people to also have some patience. In Bakersfield, Robert Price, 17 News.
And a bit of good news to pass along. Linda Wright finally got that call back, and she now has an appointment, so there is hope.